Topiramate is a medication used to prevent and control seizures, also known as epilepsy. It is often used alone or in combination with other medications. Additionally, topiramate is used to prevent migraine headaches. This medication falls into a class of drugs called anticonvulsants. It is important to take topiramate as prescribed by your doctor and to follow the recommended dosage and timing for the best results. Be sure to discuss any concerns or questions with your healthcare provider. Before you start taking Qudexy XR, make sure to read the medication guide provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. You can take it with or without food. You have the option to swallow the whole capsule or open it and sprinkle the contents on a teaspoonful of soft food, then swallow the mixture right away. Make sure not to crush or chew the mixture, and do not prepare it ahead of time for later use. Also, drink some liquid after swallowing the mixture to ensure all of the drug is ingested. To prevent kidney stones, it's important to drink plenty of fluids while taking this medication unless directed otherwise by your doctor. The dosage of Qudexy XR is based on your medical condition and response to treatment. For children, the dosage is also based on weight. Your doctor may instruct you to start at a low dose and gradually increase it to reduce the risk of side effects. It's crucial to take this medication regularly at the same time each day to get the most benefit from it. Do not stop taking it without consulting your doctor, as some conditions may worsen if the drug is suddenly stopped. If your condition does not improve or worsens, make sure to inform your doctor. Some common side effects of Qudexy XR include tiredness, drowsiness, dizziness, loss of coordination, tingling of the hands/feet, loss of appetite, changes in how foods taste, diarrhea, and weight loss. Mental problems such as confusion, slowed thinking, trouble concentrating or paying attention, nervousness, memory problems, or speech/language problems may also occur. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Be sure to tell your doctor right away if you have any serious side effects, including bone pain, signs of kidney stones, unusual bleeding/bruising, rapid breathing, irregular heartbeat, or any unusual changes in mood, thoughts, or behavior. This medication can rarely cause a serious eye problem, usually within 1 month of starting treatment, so it's important to get medical help right away if you experience sudden vision changes or eye pain/redness. It's also important to note that a very serious allergic reaction to this drug is rare, but you should seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed above, be sure to contact your doctor or pharmacist for more information. Before taking Qudexy XR, make sure to inform your doctor of any allergies you may have and any other medications you are currently taking. It's also important to discuss your medical history, including any issues with your eyes, kidneys, liver, lungs, mental health, or bone health. Qudexy XR may cause dizziness, drowsiness, or impair your thinking and coordination. It's important to avoid alcohol, marijuana, and activities that may cause you to overheat. Be cautious when driving or operating machinery, especially in hot weather. If you are planning to have surgery, inform your healthcare provider about all the medications you are taking. For pregnant or breastfeeding women, it's important to discuss the potential risks and benefits of taking Qudexy XR with a doctor. This medication may have harmful effects on an unborn baby or a nursing infant, so it's crucial to have a conversation with a healthcare professional. Remember to always check for potential drug interactions with Qudexy XR. This medication may decrease the effectiveness of hormonal birth control, so it's important to use additional reliable birth control methods. Also, be cautious if you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, and opioid pain relievers. It's important to talk to your doctor or pharmacist about any concerns you may have. And always check the labels on all your medicines for ingredients that may cause drowsiness. If someone takes too much Qudexy XR and experiences severe symptoms such as passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness and loss of consciousness. It's important not to share your Qudexy XR medication with others. Your doctor may also recommend regular lab and medical tests while you are taking this medication, such as eye exams and checking your bicarbonate blood level. Be sure to keep all your medical and lab appointments to monitor your health while using Qudexy XR. If you forget to take a dose of Qudexy XR, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. If you've missed more than one dose, make sure to consult with your doctor or pharmacist for guidance. When it comes to storing Qudexy XR, it's important to keep it in a tightly closed container at room temperature, away from light and moisture. Be sure not to store it in the bathroom, and always keep all medications out of reach of children and pets. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. When you no longer need Qudexy XR or it reaches its expiration date, be sure to properly discard it. If you're unsure how to do so, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.